and lamotrigine is a category C drug. That's why we say that a drug of choice for epilepsy in pregnancy now is lamotrigine. So that's why I did not mention it then. Hi, welcome again. Let's see the drugs in pregnancy and what are the drugs which can be safely given to pregnant women, the drugs which can be given with some caution, drugs which can be a problem in the fetuses but still have to be given because the benefits are better than the rest, and some drugs which are not to be given at all. So yes, drugs in pregnancy by the FDA have been categorized from A to X. Not of course like A to all the alphabets till X, of course. It means A, B, C, D and the category X. So there are 5 categories. So category A drugs are safe in pregnancy. These are the drugs which are safely given, like the thyroxine if you want to give in pregnancy, and the multivitamins, folic acid in therapeutic doses. If these drugs are given, they have no problems whatsoever. So these are the safe drugs in pregnancy. Now the category B drugs, they have some adverse effects. Some adverse effects are present in the animal model, but all studies in humans are safe. So yes, there may be some problems in the animals, but most of the studies on humans have shown these drugs to be safe. These are quite a few antibiotics like the penicillins and the cephalosporins, the antivirals like the didanosine, and the drugs like, yes, metronidazole comes here. It's a category B drug. That's why we say that in bacterial vaginosis, the drug of choice in pregnancy is indeed metronidazole. And drugs like nitrofurantoin. So these are drugs which are safe in most of the animal models, but a few animal models they have shown adverse effects, and in human models they are all safe. Now category C drugs, these are known teratogens in animals, but very inadequate human studies. So I would want to know what is the effect of these drugs on the humans, but the studies are inadequate. Animals it is teratogenic, but in humans they are inadequate studies, and a few studies in which we have seen these drugs when they are used in humans, in the few studies which we have, they have been mostly safe. So yes, if it is a teratogenic in an animal and I have no studies in humans, then I would not actually use. So yes, I will revise. Most animal studies it is teratogenic, and a few studies done in humans it is safe, but the studies are inadequate. So this is that gray zone kind of category, the category C. And you know what, this is the most common drugs used. The most common drugs used in pregnancy come in this. So these are the drugs like the deworming drugs like the mebendazole and the albendazole and the acyclovir, the chloroquine. So what are the drugs which are the category D? Now D category drugs are known human teratogens, and these are the drugs like the anti-epileptics and the antimalarial like quinine. So I know they are teratogenic drugs, but some anti-epileptics have to be given for making a person have the adverse effects of having an epileptic fit. So we must control the epilepsy at the risk of the baby having in a few instances having side effects. So the meaning of this is that the benefits of these drugs outweigh the risks of these drugs. So when the benefits are more than the risks, I would go ahead and give these drugs. So the antiepileptics like the phenytoin and the carbamazepine, these were drugs which were in fact given in pregnancy. Even now they are given in pregnancy, like carbamazepine is given in pregnancy, and we know that they are known teratogenic drugs, but the benefits of the drugs are better than the side effects, so we go ahead and give them, telling the patient that there is a calculated risk. But yes, now we have in antiepileptics we have a drug called lamotrigine, and lamotrigine is a category C drug. That's why we say that a drug of choice for epilepsy in pregnancy now is lamotrigine. So that's why I did not mention it then, so that we remember that yes, carbamazepine till I think around 4 years back I used to teach in my classes that this is the drug of choice, although it has got teratogenic side effects. But now we have lamotrigine. It has some nasal defects as a problem, lamotrigine, but then this is known to be a not a very high incidence. So that's why from category D, it was pulled up to category C in the FDA. So these are the category D drugs, and we give them because the benefits are more than the risks. Now, what are the category X drugs? Now, category X drugs are the ones which I will not give. They are the known teratogenic drugs, known teratogens, and the risks outweigh the benefits. And this is a very long list, but I'll tell you a few. And most of these things like the alcohol and the androgens, vitamin A, if you want to remember a few drugs with A, and lithium and radioiodine and the cancer chemotherapeutic drugs and the tetracyclines. So there are many more, but these are drugs which are known teratogens, and I would not want to give them in pregnancy at all. So these are drugs which are the categories in pregnancy. Of course, you must go into your books and read about a little bit more about their the list and the number of drugs in each category. Try and increase the knowledge of your list of these drugs. Now let me tell you a few particular drugs with their side effects. We were discussing about alcohol. Now, alcohol is totally contraindicated in pregnancy, and a lot of people say that there is some safe limit of alcohol in pregnancy. I'm so sorry, there is nothing like that. Especially a lot of people used to have this binge drinking in alcohol in the first trimester, and those have been, the baby would look apparently normal, but as the baby grows up, there is a lot of mental retardation and there is a lot of structural defects as well which can come with alcohol. So I'll just list a few problems with alcohol first. So fetal alcohol syndrome. To diagnose the fetal alcohol syndrome, all these three categories are required. That is, they are dysmorphic facial features like small palpable fissures. The palpable fissure, the opening of the eye, the palpable fissure is small, thin vermilion border. This border on the upper lip, thin vermilion border, and a smooth philtrum. This philtrum is smooth, it's like this, the face is like that. So smoothing of the philtrum and thin vermilion border and small palpable fissures, and prenatal or postnatal growth impairment, that is characteristic, and central nervous system abnormalities. Now, at least one of these is required, like structural head size is smaller than the 10th percentile, and there is significant brain abnormality on the imaging. Plus, there might be global cognitive or intellectual defects, that this person is mostly mental retarded. Quite a few of them have mental retardation. So all of these are required, 1, 2 and 3, and in the category 1, the dysmorphic facial features, all 3 are required for the diagnosis of the fetal alcohol syndrome. Now, in the fetal alcohol syndrome, you have some structural defects also which can happen. So the alcohol related birth defects can be the cardiac defects like the atrial septal defect or the ventricular septal defect. skeletal defect like the radio-ulnar synostosis and joint contractures, aplastic or hyperplastic kidneys, and strabismus, that is squint, ptosis, optic nerve hyperplasia, and conductive or neurosensory hair loss. Like I was telling you, there are a lot of neurological problems in alcohol related teratogenicity. So, conductive or neurosensory hearing loss, and then there are these minor defects like hyperplastic nails, clinodactyly, that is small digits, and pectus carinator, pectus excavatum, and hockey stick palmar creases. The palmar crease is like a, this crease is like a hockey stick. If you see the palm, then the crease which is coming from the side of the arm, from the palm, is like this. The hockey stick palmar creases, and railroad ears. The creases in the ears are like a railroad. I'll try to show you if there's a picture here. See, this creases like railroad, parallel features, so parallel creases, so that is like a railroad. So these are the alcohol related problems which you can see. If you want to write down the list. Yes, so the alcohol related problems make us decide that surely we are not going to give this drug, this alcohol, any time in pregnancy. Now what happens in some other defects which I want to tell you. I'll take out this. So, what is the effects of warfarin? Now, warfarin is a anticoagulant which is a very potent anticoagulant, but since it has got a very low molecular weight and it is readily crossing the placenta, it causes a lot of embryopathy. So, this anticoagulant used to be given as a DVT prophylaxis and also given in patients who've got these mitral valve replacement to prevent thromboembolic phenomena. So this can cause this warfarin embryopathy if it is especially given in the first 6 to 9 weeks. That is the time when there is the maximum. This MCQ has come. Warfarin embryopathy is a favorite MCQ. So from the 6 to the 9 weeks, if it is given, then a lot of embryopathy can happen, and stippling of the epiphysis. This is the one MCQ line which always comes, stippling. I think it came in the last year's AIMS exam, stippling epiphysis and hyperplastic nose. So that is what is very specific for warfarin embryopathy with depression of the nasal bridge. So hyperplastic nose, depression of the nasal bridge, and stippling of the epiphysis is the warfarin embryopathy. And let's see another drug, leflunomide. Leflunomide is a drug which is given. Now this is a new drug which has come in the list of things, and I'm sure that in maybe it has come earlier. I've not come across, maybe pharmacology people have come across this question, but yes, this is one drug which is now a problem which is probably going to come in your exams very soon. A pyrimidine synthesis inhibitor, treatment for rheumatoid arthritis it is used for. It's a good drug for the treatment, but yes, the problem is if you're using this drug for the women who are in the childbearing age, because this is detectable in the plasma for up to 2 years. Now that's the problem, up to 2 years. So it is associated with multiple abnormalities like the hydrocephalus and the eye anomalies, skeletal abnormalities, and embryonic death. These all can happen with this leflunomide. So up to 2 years. So even if suppose a woman is planning a pregnancy and she was on leflunomide for rheumatoid arthritis treatment, she must actually wait for 2 years before she plans a pregnancy. So yes, that's not practical. So we have a cholestyramine treatment washout for this. So cholestyramine treatment is known to bind with this leflunomide and take it out from the circulation of the woman. So yes, if she must use leflunomide and she must try pregnancy, cholestyramine washout, and repeat the values after 14 days, and once the levels of these drugs are undetected in the circulation, then we can ask the woman to try pregnancy. And another drug is the fetal hydantoin syndrome, the phenytoin ingestion. The phenytoin, all of you know that it is an anti-epileptic which should not be preferably given in pregnancy. So the question which has come to you many times is, a woman is pregnant on phenytoin already. So when she's already on phenytoin, what are you going to do if she comes to you at 8 weeks or 9 weeks? Then there's no point changing the drug. If she's already pregnant and she's on phenytoin, even if you stop the drug, it's going to take another 1 month for the drug to wash out from the system. So we always say these anti-epileptics, if you must stop at least 3 months before she's planning a pregnancy. We always say, and a woman with epilepsy, she better not get pregnant just when she decides to get pregnant. She must always visit a gynecologist and discuss the drugs she's taking, or a neurologist who is giving her the drugs, and plan a pregnancy. And at least 3 months of washout period is given when all these teratogenic drugs are given, like carbamazepine or phenytoin. So yes, if she's already on phenytoin and she's conceived, then there's no point changing the phenytoin. And yes, around 5% and less women are going to have children with which are affected. So the benefits are more than the risks, like we said, and you continue the phenytoin. But yes, the problems of this fetal hydantoin syndrome, which is same to the ingestion with carbamazepine also. Please remember, fetal hydantoin syndrome is caused by phenytoin, but it is also caused by carbamazepine. So the features are the upturned nose and the mid-facial hyperplasia, long upper lip with thin vermilion borders, and digital hyperplasia. So when there is these, we say it is because of carbamazepine or because of phenytoin ingestion in the mother. So these are the drugs which we wanted to discuss. Of course, it will be good if you can go and read about a few more drugs which are rarely asked in your exams, and they can never be a full list that we can discuss. All right. Thank you.